In this case, we'll be seeing how to do a PDEK in an ice syndrome patient. So this patient was operated elsewhere, cataract surgery done a couple of years back, and presented to us with a corneal decompensation. And we decided to go ahead with a PDEK. Now, when you start off with a PDEK, initially we try to remove the epithelium for better visualization over here. And in this patient, if you observe, there is iris atrophic patches and you also have a large area of a gap inferiorly. So initially we try to put in pilocarpine just to see how much the pupil constricts. And I put in my AC maintainer and do a partial entry incision there. And I'm trying to put in air to try and do the desmetorexis over here, but as you can see, the air keeps escaping behind the iris and it's shallowing my anterior chamber, and you can see me here trying to egress that air out from behind the iris. And so every time I try to go in with an AC maintainer and try to put in air, the same thing repeats itself. The air keeps escaping. So I shift it to saline and I start doing my desmetorexis under saline. So you can see the DM scoring happening over there under saline. So once this is done, I extend my incision to full thickness in order to put in the graft inside. So the preloaded PDEK graft is taken, and again you can see the problem there is I start seeing iris plugging my wound, and it is not allowing me to go in freely with my injector. Try to hydrate the side port and try to go in with the injector inside. And this time it goes in easily, and as you can see that small air bubble which is in the middle of the graft, which also actually helps me to open up the graft much easier. So once the graft is in and you've identified the scroll, you try to open it up and then you put in air inside. And here we try to pull in the PDEK graft to the center to center it. And the advantage here, again, like I told you, in a PDEK you can always manipulate the graft, especially at the edges, because it's easier to drag the graft. And once your main port and your side port are sutured, you have a secure airtight chamber, and that's when you close.